Hey everybody, and welcome back to another episode of Vet Candy Rounds with the Hawleys. My name is Dr. Quincy Hawley.
And I'm Dr. Tierra Hawley.
This program is brought to you by Elanco Animal Health.
Hi, I'm Dr. Moore, and welcome to my TikTok. You don't just have to be deep in the woods to find ticks carrying Lyme. Due to the urbanization of deer and mice that ticks feed on, ticks can increasingly be found in cities. That's why it's essential for pet owners to stay one step ahead of the spread with an annual Lyme disease vaccination for their dog. Stop Lyme before it starts.
And on Vet Candy Rounds, Vet Candy Rounds is a show in which we talk about a really cool mystery case, almost like we were in vet school again. So if you can remember, back when you were in vet school, we go and sit through rounds with an expert.
So today we have a very special guest, Dr. Anthony Gonzalez, who practices in New York. He's also a veterinary classmate of mine. How's everything going, Anthony?
Great, guys. How are you?
We're doing great. It's definitely really good to hear from you again. We're right now in the Fayetteville, North Carolina area. I have a house call practice where I specialize in integrative medicine.
And of course, we've got the two little girls, got a 5-year-old and a 2-year-old, Cadence and Sky. And on the weekends, I do relief work. And during the week, I do get motivated, my motivational and well-being speaking thing. But it's really nice to see you, man. We're staying busy.
Oh boy, well, accrued a little more debt, lost some hair, but finished internship, did residency, now just working as a critical care specialist in the Northeast.
All right, so Anthony, I remember coming down to Tuskegee and hanging out with you guys, and you were the class president, if I can remember correctly. Can you tell us what type of student was Dr. Tierra? Was she loud? Was she out partying all the time? Sitting in the front row? Sitting in the very back of the classroom? Can you tell us what type of student she was? Give us the inside scoop.
Tierra was quiet. Tierra had her little dog. And yeah, she just went with the flow. Very, always talking and thinking about Quincy, so so no surprise that we're all still sitting here at this table.
That's awesome, man. So thanks for telling us what type of student Tierra was, but let me ask you, what type of student were you, Anthony?
Yeah, I mean, I think I was the overachiever in school. I was like president of everything, but I think I don't think I realized how fast it would go by and how much I would actually miss being at Tuskegee. I'm sure you remember the social events that I threw, so I think it was just being able to just get together and just hang out and just de-stress. We were all kind of in a fairly new environment, so it was we had a lot of good bonding. Our class was pretty cool.
Well, I definitely remember the social events. We had a lot of fun at Tuskegee, so right. That was always great.
And I can't speak to the social events, but I heard a lot about them, so.
Yeah, I think I can definitely agree with you there in that, at Tuskegee, most of us were coming from different places, so it was nice to have that closeness, that kind of family sort of environment. So that was definitely one thing that I miss for sure.
Right, yeah, and for me, I think that I just miss the freedom. I think I miss not having kids. Probably the most out of everything. That's not specifically about veterinary school, but I miss that freedom, if you know what I mean. All right, Anthony, so you told us what you miss about vet school, but as we all know, vet school has its pros and its cons. What do you not miss about vet school?
I don't miss having to get dressed for 8 a.m. lecture. I'm sure you remember that dress code very well. I don't miss having block exams. I don't miss driving down 85 and getting pulled over because they just love to give out tickets. I don't miss any of that, but I have residents that remind me every day what I've forgotten since vet school, so it's been great.
Yeah, I mean, all of those things, I definitely remember having to dress like business casual and getting all dress early in the morning to get to lecture. That was awful. The block exams definitely gives me PTSD, so we should probably talk about something else. What do you think, Quincy?
I remember all of that for y'all. I was so glad that we didn't have to dress up and wear suits and ties and everything like you all did. I mean, it looked good. It looked professional, but I mean, sometimes I just want to dress down. I really appreciate that opportunity about our vet school.
Yeah.
And then I also remember y'all's exam schedule as well. Ours was completely different. We would have them very spaced out. So we didn't have block exams, but I remember you would basically be like freaking out. Like the blocks are coming up, you know? And we would have debates about which is worse or which is better, which has the most benefits and things like that. So I totally feel you, Anthony.
Yeah, and so for the listeners who don't know what block exams are, it's basically all of our exams are pushed into like a week. So, or a couple of days. So you might have an anatomy exam at first thing in the morning, and then right after that you have a physiology exam, and then right after that you have your histo exam.
It's basically like finals week.
It's like finals
every
week.
time you have exams multiple times throughout the semester. That's what block is, basically.
Exactly. Yep.
All right, Anthony. Well, thank you for joining us on the show today. We're so excited to have you here. And on our show, typically what we do is we have the specialist, you in this case, to go over a really cool case, something that is maybe a little bit different for our listeners and our audience. What do you think about that?
Yeah, so Anthony, tell us what you have for us today.
Well, I actually just saw a 4-year-old male-neutered golden-doodle who was being boarded over the weekend. And the owner was away on vacation, and when he came back on Monday, found the golden doodle to have some lower back pain, seemed to be shivering, not himself, and did not want to eat the first day or two that he was home.
Okay, so we have a 4-year-old male neutered
Golden doodle,
not labradoodle, golden doodle. And what was the body condition score? Anything unique on that physical exam? Or any known, you said back pain, so any known trauma, anything like that?
He was perfect. He was 4 out of 9.
Okay, so his body condition score is normal. Were there any other clinical signs that you noticed on the pet? And also, was there any history of trauma that may have happened during that time that he was at the boarding facility?
No known trauma. The boarding attendant did note that he tried to, they were humping, a couple dogs were humping each other in the play area, and there were a couple bigger dogs that were much bigger than him.
Oh, that sounds brutal.
I feel bad for the poor guy.
Okay, Anthony, so I've got a couple of questions for you. Aside from the lower back pain, were any of the other joints painful or anything like that? And also, what was the pet's temperature?
He had lumbar pain. Definitely responded whenever I palpated his lower lumbar region. I can't say I really appreciated much peripheral limb pain. All his peripheral joints felt soft. Nothing felt inflamed. No overt dislocation, no fracture. The only source that I got pain, or at least some sort of a reaction, was his lower lumbar region. And his temperature was mildly elevated at like 103.2.
Okay, so it sounds like we have a mildly elevated temperature at like 103.2 or whatever.
Yeah,
and
that's
then
right.
we only have lower back pain, so no other joints are inflamed or painful, anything like that. And what else do you want to do, Dr. Tierra?
Were you able to do any blood work or x-rays on this pet?
Yeah, well, I spoke with Dad, basically described my clinical exam findings and gave him the option. You know, I thought it was a little strange for the dog just to have a little bit of back pain and be this profoundly affected at home in terms of not eating, not wanting to play, having a mild fever. It just seemed a little extravagant just for some lumbar pain. So I offered Dad a basic diagnostic workup, which included baseline blood work and imaging, specifically radiographs of his lumbar region. Well, Dad declined the x-rays, but he allowed me to do a in-house lights and a PCV. They were normal. PCV was 35 and 6.6. Electrolytes were all normal. Acid-base status was normal.
Okay, so we had the electrolytes done, and that was normal. And we did a packed cell volume. That was also within normal limits. And I'm still a little bit shocked about the x-rays. You said they declined the x-rays. What do you think about that?
It's so this is a golden doodle, right? And like usually these dogs are pretty expensive. So how was it that, the owner didn't want to pay for all the diagnostics that you wanted to run?
Right. I think that's pretty standard though sometimes for the really expensive dogs. What do you think, Anthony?
No, and I also wasn't sure how strongly to push the x-rays because I didn't really feel like it was anything orthopedic as far as I can tell. Like his pelvis felt fine on rectal exam. I didn't feel any fractures. His hips felt in place. If anything, I was suspecting potentially some soft tissue injury, potentially a disc, and I wasn't sure the value of taking an x-ray.
Okay, Anthony, so are there any other pertinent pieces of information? I mean, vaccine status, has this dog been, do they travel? Have they been out of town? Anything like that?
Right, that's some really important information to know.
Right, especially the vaccine history, right?
Right. Mm-hmm.
Well, in talking to the owner a little bit more, I just asked if there was any other history outside of just this isolated weekend. Has there been any travel history? What the dog's vaccine status is, his heartworm, just kind of a baseline assessment of the dog's overall prior history. And what Dad had explained to me was that about a month ago, they had gone camping. And he does not use flea and tick preventative until June because that's when fleas and ticks come out again. And so the only other piece of information was that he is active on his lepto vaccine and rabies vaccine, and that's all. They went camping in upstate New York.
Okay, so they've been camping in upstate New York, and you said that they haven't started the flea and tick preventative because ticks and stuff like that, they don't come out until June, which is actually something we hear very common, right? That, we don't need flea preventative because it's cold outside or for whatever number of myriads of reasons. Yeah, the owners tell us that, but we do recommend like flea and tick stuff year round. Okay, cool.
And that's even common here in North Carolina. You would just expect that people know that fleas, ticks, everything can just kind of be out all year round, but
Right. And what do you think about the vaccine that the pets had?
So we're only up to date on, you said rabies and then the lepto vaccine, which, are important. So there's no distemper parvo vaccine, there's no Lyme vaccine, Bordetella, none of that. So, where do we go from here, right?
Okay, so with what we have so far, it sounds like we're not on, ectoparasitic preventative, right? No flea, no tick preventative, and we haven't had certain vaccines. And so I think that a good test maybe, and Anthony, you can let me know, would be maybe something simple and inexpensive like a 40X, right? To test for a few different tick diseases as well as heartworm disease.
Yeah.
I think I can, so I offered him a in-house SNAP 40X, and it came back positive for Lyme. Okay,
so we tested positive for Lyme disease on the 40X. Tierra, what does that mean to you?
So I think for me, it's important to know whether this is an actual active infection versus if this is just exposure. But we all know that it's very common to test pets who show up positive on SNAP tests or 40X tests, but don't actually have an active infection. So at this point, maybe we, thinking about doing some type of confirmatory test to make sure that is actually an active infection.
I think that's a great point. So Anthony, did you all do any type of confirmatory testing?
That's all. I offered Dad to do a Quant C6 test to confirm that this was an active infection and not just exposure or vaccine that he was unaware of. And he agreed. He wanted to make sure 500% that this was a true active infection. So we submitted a quantitative C6 antigen test.
All right. So we got some sort of a diagnosis for the pet. Did you start treatment? And then what type of treatment did you do for this pet?
Yeah, so in the interim, while that test came back, which usually runs about 3 to 4 days till I get the results, I started him on a course of doxycycline as well as a course of gabapentin for back pain.
Okay. And how did the pet respond to the doxycycline and the gabapentin?
The dog within 48 hours responded very, very well, was eating again, seemed like his normal active self, although I tried to tell Dad, make sure you exercise, restrict him as much as possible, but you know how that goes. And I received the Quincy 6 back this morning actually, and it came back markedly high, confirming that it was a true active Lyme disease infection. Yeah, it turned out well. It just was a nice reminder that, you know, we are seeing Lyme disease so much earlier because the weather is just so much warmer. We don't have periods where, you know, the weather is freezing out and ticks are not hiding as much. And also Lyme disease is not evolving, but it's displaying a wider spectrum of signs. So we classically always think of Lyme disease presenting as arthritic pain or kind of peripheral limb pain. And this dog really just had back pain, really no peripheral limb pain at all, which, you know, could have just thrown me off to think, hey, this is probably just back pain from getting humped at daycare. But thinking, pulling everything all together, the fever, his inability, his desire to not want to eat, just all really played more into it.
Wow, that's great. I think, you know, personally, like, started to see like cases all over the place, all over the country. It seems like the distribution of Lyme disease is starting to spread a little bit. You don't necessarily expect to see a lot of cases in a colder climate, you know, so like you said, with New York and the temperature is getting a little bit warmer, so ticks are out more than they wouldn't earlier in the season than they normally would be. Is very interesting.
Yeah, and I think along those same lines is that the clinical signs for Lyme disease could look like a lot of different things. It could look like arthritis. It could look like getting humped by a bigger dog, apparently. And so it's really important to keep Lyme as a differential diagnosis, to your point, Anthony.
Yeah, very good point. So what are your recommendations on things to do to prevent Lyme disease or any other tick disease for that matter?
Staying away from bigger dogs that can hump him, and making sure that he stays on flea and tick preventative year-round. I actually had to refresh myself on the flea and tick products because the last time I really ever dealt with flea and tick preventative was in school. Vaccinations are great, but we just have to remember that it doesn't 100% provide full immunity, and so we always just have to be sure that we keep up with our preventative care.
Okay, yep, so perfect. The vaccine and then the preventatives. And so we have topicals, we have collars. Not all collars were created equally.
No.
And not all flea and tick products were created equally as well. So be cognizant of that. And then we also have topicals, collars, and then also oral tablets. And there are really good options for all three of those categories. Would you agree?
My favorites personally are the orals. You give one every month and it helps prevent and repel fleas and ticks. I find them to be very, very effective. Yeah,
there's actually one that lasts for 3 months at a time as well. And along with, getting the vaccine and getting the monthly flea and tick preventatives, there are also environmental things that we can do to make sure that we are preventing ticks or the possibility of ticks for your pets. And so things like making sure you keep the grass cut. And if you're kind of like I am sometimes, you don't have your grass cut, just don't let your dogs go back to the highly weeded areas where there are lots of shrubs and bushes. And if you do allow them to go back there, hopefully they're on some preventative, but also check your pets too, right? So check your pets to make sure that the products are working and that there are, in fact, no ticks on your pets. And oftentimes ticks like to hide in like little crevice areas.
Yeah, they like the little crevices, so it takes 48 hours for Lyme disease to be transmitted, after being bitten by a tick. So if your pet's been out running around, you're hiking, or they've been in tall grass or woods, checking folds of like where the ears are, they have a little flap down in the ear.
Right.
Checking, around like the belly area, any area where there's skin on skin contact. Those are spots where ticks like to hang out. I've even seen a tick in the gums and under the lip of a dog before.
Oh,
so,
wow.
Yeah,
Wow.
they'll just wedge right on in there.
Guys, ticks are serious these
Yeah.
days, right? About spreading their diseases. But check this out. And also be really careful for yourself too. Humans can get them as well. So if you have a client, and you already know this, but if you have a client and their pet has a tick on it, then make sure that they're checking or you can recommend or suggest that they check their kids for ticks, check the belly button. One time she had a tick in her belly button. Anthony, dude, she had a tick in her belly button, and it grew there, but we found it and we extracted it and all that good stuff. And,
I don't think it had been there for long. I was like screaming and like.
It had been there for a while. It had some size to it.
I was
man.
terrified. I was like, what is this down here?
Stop lying. It was in there for a month.
But
Kidding,
I made you take it out. But like that was
Right.
terrifying, But
But it's pretty serious though, right? Because that tick could have
serious.
been carrying some disease.
Could have been carrying some tick disease, and you have to make sure you do that. If you live an active lifestyle, you like to go hiking, or again, you have a pet who just isn't on tick preventative, you need to make sure that you're checking yourself and your family.
Right. And then the last thing that I'll say too is be really cognizant of your dog's lifestyle, right? If your dog just sleeps in your bed and walks on the sidewalk and goes out in a stroller whenever you take it walking, you're just rolling it around basically, then maybe the risk for tick exposure isn't that great for your pet. But again, if you're going hiking, if you live out in the sticks a little bit, then it's really imperative, as Anthony described here today.
Yeah, even if it is that little like dog that just hangs around in a stroller, if you take it like doggy daycare and places like that, there are opportunities for them to pick up things there as well. So it's just in general, like year-round flea and tick preventative is very, very important for your pet.
Yeah, so if we can check them every day, if ever you go out into the park, if ever you go somewhere where you know that there's ticks, high grasses, areas where ticks like to hide, areas that are deer filled, just make sure you check your dog afterwards and be able to remove ticks as soon as they latch on. That way you're not even giving them the opportunity to transmit any organisms.
Thank you so much, Anthony, for joining us today. We really appreciate learning about, your case and just catching up and, seeing how you're doing. Hopefully you can maybe join us on another show in the future.
Absolutely, man. This has been a lot of fun. We really appreciate you coming through and doing this episode with us.
Hey guys, it was so great catching up with both of you. Thank you for having me on your show. This was awesome.
All right, well, thank you for tuning in to this episode of Vet Candy Rounds. We really appreciate you coming here and spending this time with us today. And be sure to like, comment, share, and subscribe to our podcast and channel. And don't forget to follow us at My Vet Candy.